Hello there, I'm Janelle Thompson, your nurse practitioner at the Student Health Clinic, and welcome to another episode of What the Health. Today we're fielding the student question of strep throat. So strep throat is actually a bacterial infection and it's caused by Streptococcus A. Most of the time, sore throats are actually caused by a virus, but it is important that if it's caused by Streptococcus A, that it is identified and treated. So strep throat is spread by respiratory droplets, by mucous membranes. So you can get strep throat from somebody coughing on you. You can get it from somebody who has a sore, such as like impetigo, and them touching that and touching your mouth. You can get it from kissing. Interestingly enough, you can actually get strep throat from your dog. So I specialized in ear, nose, and throat for 7 years, and when we had patients who would come in who had recurrently gotten strep throat over and over again, then sometimes the missing link was the dog, and we would have them take the dog to the vet and get that tested for the strep bacteria and get it treated if that was there. So strep throat usually is fairly obvious. It is mainly a sore throat, but oftentimes accompanied by a high fever. It also can be accompanied by maybe a little bit of ear pain, and that's because the back of the throat shares a branch of the trigeminal nerve, which actually branches off through the ear, so it can refer pain up into the ears. Strep throat can cause the lymph nodes in your neck to become swollen, tender. Strep throat also can cause some spots on the roof of your mouth in the very back. Your tonsils can become swollen, and sometimes they'll even get debris on them that is white and pussy. And in medicine we call that exudate. So those are the most common presentations of strep throat. Okay, Joan, and so I'm going to go ahead and take a swab for strep throat testing in the back of your throat. And what I'll do then is I'll have you open your mouth and say ah, and I'm going to take the swab, go to the back where your tonsils are, and I'm going to rub the swab in the back on each side. And so because your throat's sore, it's going to hurt a little bit. And if I need to use a tongue depressor to hold your tongue down, I will. We'll just see how it goes. Okay. So you can remove your mask because I have all of this on. Okay, so open and say ah real big. Ah. Good. Sometimes it gags a little, so I'm sorry if it does. Good job. Okay, all done. All right. And this takes about 6 minutes to run the test. So I'll be back and give you the results. Okay, and so this test is positive for strep. You can see that there are 2 lines that have returned, and the top line is showing the control, and that means that the test actually has functioned the way that it's supposed to. And then the line below that shows that it indicates it as being positive. So a negative test would show only the control line. A positive shows both lines. So this would be a positive strep. Strep throat will eventually go away. It will go away usually in 3 to 5 days if you leave it alone. But we don't want to leave it alone. There are reasons for treating it with an antibiotic. First of all, you'll get better sooner if it's identified and you're treated with an antibiotic. Antibiotics will help prevent that infection from traveling, migrating like to an ear infection, leading to potentially infection even in the brain. There is a condition that can happen to the tonsils that's called a peritonsillar abscess, which can be a medical emergency. Strep throat can also cause a condition that happens 2 to 3 weeks later. Even though the throat pain improves and strep throat seems to go away, it can cause a condition called rheumatic fever, which can lead to a very high fever, affect your joints, can affect your heart, and strep throat can also affect your kidneys. So it's a good idea if you have the symptoms of strep throat to get that looked at right away. So what happens when we do treat you for strep throat? The medical treatment is really to put you on an antibiotic, and you are considered contagious until you've been on the antibiotic for 12 hours. You also can do things though that can make yourself feel better in the meantime and while the antibiotic kicks in. So gargling with warm salt water. And that works to help clean off the debris on your tonsils, but it also works to take some of the swelling out of the tonsils in the back of the throat too. If you're not allergic to ibuprofen, you can take that for fever, pain. You could also use Tylenol or acetaminophen. So you always need to finish your antibiotic, because if you think about what an antibiotic does, antibiotics start to bring that level of infection down little by little. Think of stair steps. Each time you take that dose, the level of bacteria is reducing. But if you stop taking the medicine and you've only gone halfway down those steps, that bacteria is going to continue then to replicate again and go back up. And it still is known that it's a good idea that even when you're done with your antibiotic or before you've even finished it, to either boil your toothbrush or throw it out and just get a new one, because you can harbor bacteria in your toothbrush and it can reinfect you. Viruses, not so much, but bacteria, yes. So thank you for joining me again for another episode of What the Health. And as before, please keep bringing in all of your questions, topics that you want to talk about. I really enjoy getting this feedback from you and making this your program. So we're going to attach the number for the clinic and also our email here, and anything's on the table. Thank you so much for joining me. What the Health.